Oral ulcers. Differential diagnosis and treatment. Ulcers. Oral ulcers. Differential diagnosis and treatment. Ulcers orales. Diagnóstico diferencial y tratamiento. Published by ScienceDirect.com. Introduction. Oral ulcers are usually very painful and are a frequent reason for consultation. Infectious processes, neoplasms, gastrointestinal diseases, blood disorders, rheumatic diseases, immunological diseases, trauma lesions and other factors are among its causes. 1. 2. An appropriate differential diagnosis is necessary due to the various factors that can cause them. Ulcers can be primary, when not preceded by a previous lesion, in the case of canker sores, or secondary, aphthoid, to trauma or a ruptured blister or vesicle. The canker sores, described by Hippocrates in 400 BC, are usually located in the oral mucosa, lips, tongue, floor of the mouth, soft palate, uvula, etc., and pharyngeal mucosa. They can also be observed in the genital region. The primary lesion is neither a vesicle or a blister, but direct ulceration due to epithelial necrosis which exceeds the basement membrane, exposing nerve endings and causing discomfort or pain. 2. 4. If they become large, they can leave a scar after healing. Clinically, they present with painful ulcerations, of different sizes, round or oval and clean edges. The necrotic fundus is covered by a yellowish-white fibrinous exudate and its periphery is framed by a border or red halo of hyperemic origin and have a tendency to relapse. The aphthoid or secondary ulcers, usually infectious, which begin with a major lesion, vesicles or vesicular pustules, clinically and histologically different from the true canker sores. Other aphthoid ulcers have a trauma-related origin, with acute or chronic progression, in response to a repeated and persistent mucosal trauma. Some tend to chronicity and may be recurrent, e.g. herpetic stomatitis. The aphthosis are certain processes that occur with canker sores or aphthoid ulcers and usually with systemic repercussions. In these processes, ulcers may be located in the oral mucosa and in others such as genital, anal or conjunctival. Section snippets. Differential diagnosis. The first step in making a correct differential diagnosis is the medical record. The patient's medical history provides essential data to identify the type of lesion. The medical history, family and personal history of systemic or skin disease, drugs, allergies, food and toxic habits, should be investigated. The following should be established with the case history questioning: time of appearance of the first lesion, progression period or, if recurrent, duration of lesions, affected oral. Treatment. Depending on the established diagnosis and according to the data collected in the clinical history, the most appropriate treatment may be considered. We pay special attention to therapy against canker sores, which stand out as being the most frequent.